Hello everyone, this is Brett at Progressive Mobility Physio and Performance. Today we're going to be doing a continuation of our shoulder series, working on some exercises to help improve mobility at the shoulder girdle and the scapular thoracic joint, and then the relationship between the scapula and the glenohumeral joint. So today we're going to be really focusing on the clavicle and the importance of the clavicle. So we have two different spots of the clavicle that make up joints. We have the sternoclavicular joint, which is across the manubrium in the chest and its connection there. Then we have the acromioclavicular joint between the acromion and the clavicle. We have those ligamentous attachments along the clavicle and the scapula, as well as the clavicle and the acromion. And all of this is an important piece of the relationship between the scapula, the shoulder girdle, and the clavicle. The clavicle is super important because it is an important piece to brace the shoulder, and it helps to absorb and distribute force from the upper limb into the axial skeleton. So if you think about falling on an outstretched arm, that force that gets transmitted through the upper arm is dissipated largely at that clavicular joint and that clavicle progression. Not all of it, but a good portion to be as a buffer to the axial skeleton. We have a lot of motions at the clavicle: elevation, depression, protraction, retraction, rotation, and as well as muscular attachments such as the trapezius, the deltoid, sternocleidomastoid, the pectoralis major, and the subclavius. So as we can see, the clavicle plays an integral role in being able to create sagittal, coronal, and transverse motions and dynamic stabilization at the shoulder joint and for the upper extremity. Also, there are times where we have thoracic outlet-based syndromes where we may get some dizziness, vertigo, numbness and tingling out into the hands. Neurogenic thoracic outlet syndrome, for example, can be affected by the clavicle, restrictions in clavicular accessory movement, and then compressions of the brachial plexus and the subclavian artery that also go through this region, along with the subclavius muscle and the pectoralis attachments and the sternocleidomastoid attachments becoming restricted, hypertonic, immobile, leading to some of those thoracic outlet type symptoms coming from that area. So today we're going to be doing an exercise called Intra Scapula. This is the brainchild of Grip Approach, Dr. Ben Fergus. Check out Grip Approach and his teachings at Grip Approach on Instagram. They've got lots of great content. So we're going to recreate that exercise today. We're going to use the floor version, and then in a later video, we're going to do a wall-based version. So for the floor version today, you're going to lay on your side. You're going to take a block or a pillow, and you're going to place it under your head like so. And then it's best if you have a foam roller to utilize for the top arm. So we want to think the shoulder tip on the bottom arm is pressed into the ground. We want the elbow and the wrist to be on the ground as well. We want to think about that space between our thenar and hyperthenar eminence right here. We want to grow that long towards the wall in front of us and away from the chest cavity. Then we're going to have our other arm on a foam roller. You can also use like a yoga roller or something like that, but it's best to have something that helps you to roll your body. And then you're going to have your back leg, your bottom leg straight in line with the torso, and your top leg bent over. So I'm continuing to grow the arm long on the downside arm, and then as I do that, I'm going to reach forward with the top side arm, and then I'm going to use the force of my downside arm pushing away from my body to rotate my torso back. So the downside arm is the one that's truly doing the work. So I'm going to continue to reach forward with my bottom arm as I rotate my torso towards my chest. And then I'm going to continue to grow that arm long and use it to almost pull the upper arm and torso back to the neutral position. We want to make sure that we're not shrugging our shoulder up towards the ear. We want to make sure that we're getting that rotation through our chest, and we should feel the work through the downside arm. So with this exercise, we are focusing on restoring some of the rotational components of the clavicle, which is super important when we think about horizontal adduction and being able to bring the arm across the chest, being able to set up in a push-up position, being able to set our shoulders properly when we go into a rowing position, and we're just trying to work on restoring that accessory clavicular motion at the upper extremity. check out more videos on our YouTube page. And thank you so much for watching. Give us a follow at progressive_mobility and then at progressive_mobility_AT on Instagram.